Boots in Baltimore. I'm Leanne Blanchard. I'm here at Outlast Health and Performance with Shannon and Corey Hall. So, tell us how Outlast has a completely different approach to health and fitness and performance.
Sure, go for it.
Yeah, so really the big thing is that we have a big integration between more services than just one. So typically you'll have a physical therapy clinic or just a fitness studio. We combine physical therapy, massage therapy, nutrition, functional fitness, a recovery studio, kind of all under one house. We are all performance physical therapists is what we call ourselves. So we are doctors of physical therapy. We hold certifications in different like strength and conditioning specialties and CrossFit. So we're really, and nutrition. So we're really about more than just how do we get someone out of pain, but really how do we get them to perform better, whether that's in sport or just everyday life.
So kind of a one-stop shop for everything.
Exactly, yeah.
So how is it different working out with somebody who is a physical therapist?
Yeah. So we like to consider ourselves movement experts, and really through all the physical therapy training and all the coaching training, we really dial in and kind of nerd out on how people move. So we tend to be a little bit better prepared to watch someone move and make sure that they're doing things safely. But then also we get to build into our workouts injury prevention. Think about some of the common ones: back pain, maybe it's a core weakness or rotator cuff issues. We kind of build in the physical therapy stuff mixed with the fitness.
So I've done CrossFit before, and I'm used to people watching for butt tuck and various assorted other bad things that I do. But it is different when the person watching you is your physical therapist, because they are also familiar with your health history.
Absolutely.
So they know, and their modifications are going to be more specific, right?
Correct.
Yeah.
I'd say that's probably the most common route of how people find us for fitness, is that they're usually a physical therapy client first and like, I kind of like my sessions, how you kind of throw in some fitness into my sessions. I would like to keep doing this, and then it kind of nicely feeds them right into our fitness program. And then us as coaches on that side of things, we can adapt things quickly because we know their history, like you said.
Yeah.
Interesting. So I noticed on Google it does come up as a physical therapy clinic. So that is how most people find you?
Yeah, absolutely. Google's interesting because you have to pick one.
Oh.
Right. I have both in there, but it only shows whatever the primary is. And first and foremost, we're physical therapists, and that's our highest degree, that's our highest certification, and that's certainly how we attack most things, is from a physical therapy background, but absolutely still a fitness studio.
So how do memberships work, or how does it work if you want to come here?
Yeah, absolutely. So we offer just like basic fitness memberships. You can just come here and do the fitness classes, which is kind of similar, like you said, you did CrossFit, kind of similar to that program where it's one workout per the day that everyone does, but we do a really small group with that. So you can just be part of that. You can also bundle that with other services. So say you also want to do physical therapy, you can do maybe a physical therapy session once a month in addition to addition to the fitness, or you could also do massage therapy in addition to fitness. So we kind of can bundle them together and create package options based on what the person needs.
So do people maybe start out with physical therapy and then taper it down to fitness after they're fixed a little bit?
It's the most common, I'd say. That's the most common, especially if someone's coming in for physical therapy and doesn't have a gym membership. And we also network with a lot of the local gyms, and our goal isn't necessarily to bring them out of those gyms into our gym. It could just be, how do we get them back to their gym safely, or how do we keep them active in some sort of fitness that's going to be great for them. But certainly if someone's kind of coming in fresh, they tend to do either physical therapy first, trickles down into a fitness membership where we can keep our eyes on them as they work on fitness, or if they're coming in and they feel fine, they move well, maybe it's just a fitness member.
Okay. So do you take insurance, or can people use their HSA, FSAs?
We do not take insurance, and that is intentional for our business plan. Being out of insurance allows us a lot more freedom to be one-on-one for an hour with that patient. You'll always see the same provider every time you come in. So we really enjoy that kind of specialty of care, and it may actually cut down on the total number of visits you need of physical therapy if you're getting one provider and getting that full hour every time you come in. So that was intentional for us in our business plan. We do take HSA and FSA, however, if people do need that kind of supplemental help as well.
Well, yeah, and it's a giant hassle to have to go to
Yeah.
physical therapy
Yep.
multiple times.
Right.
It takes out of your day, the travel, the expense. Yeah.
Yeah.
The typical model is 3 times a week for 6 weeks, and that's 100% dictated by what insurance pays for.
Yeah.
You tend to be with your therapist for 15, maybe 30 minutes if you're lucky, but they tend to have other patients there at the same time. A lot of times you get passed off to a high schooler or someone who's just like interested in physical therapy and they're there to get experience hours.
Yeah. And then
So,
the next
yeah,
time you go, you may
it's
be with a different therapist altogether who
different
doesn't know your
therapist,
case. So it can
it's-
just be hard to kind of get the wheels spinning.
Yeah.
But we've both worked in those environments. We totally understand there's great therapists in those environments. It's just kind of the system is a little broken. So that's why we decided
Exactly,
to kind
yeah.
of pull away from it a bit.
But HSA and FSAs are
Absolutely.
Absolutely. You can submit for reimbursement through your insurance if you have out-of-network benefits as
Yeah.
well.
okay.
And one thing to kind of tag on is we are in the process of getting credentialed with Medicare. And that's a big thing for us. It's the first and only insurance that we're going to accept. And the reason, well, there's really two, is one, if you have Medicare, you're very unlikely to pay out of pocket for healthcare. It's just, I mean, you've been paying for Medicare your whole life, so like I get it. And two is that's the only insurance where you can financially as a business see someone for one person in an hour.
Oh.
So they actually reimburse a lot better than the other companies, the more private ones that tend to be a little bit more strict with their funds, so to speak. And I guess the third reason is just healthcare for people over 65, just, well, I'll just say it's kind of subpar. Like a lot of places just don't give them the care and attention they need.
Well, I would imagine that a senior who's on Medicare might want to go to a gym, but then would not be able to, wouldn't feel safe.
Right.
Like, ooh,
Absolutely.
that looks appealing, or that
Yep.
seems interesting. I lifted when I was younger,
Yeah.
but
Yeah.
I'm scared.
I like to think we have a less of a barrier to entry. It's just a little bit more, open, I guess, welcoming, because it is physical therapist
Right.
coaching. That like you don't have to worry about, well, what if I get hurt, or is this going to be too much?
Are they going to
'Cause
push
we
me
can-
too hard
Are
and
we
not
going to
really
push you
understand?
too hard?
It's not
Yeah.
rah, rah, go, go all the time. It's like, let's listen
Yeah.
to your body today and see how you're feeling. And if we need to push, great. If not, let's
Yeah.
hold back a little today.
Yeah, our whole thing is overall health and longevity. We want people to live longer, but we want people to live better longer.
Outlast.
Outlast.
That's right.
That's the whole reason behind the name. And what that looks like for each person is different, right? And if you're 70 years old, maybe it's you want to be able to go up and down stairs without, holding onto a railing, so you have groceries in your hands. You want to get down on the ground with your grandkids, like the things
fear
that
of
you.
falling
Oh my
Yes.
goodness, yeah.
is omnipresent. Yeah. So being confident and comfortable, being up, being
Yeah.
down.
Absolutely.
And that starts when you're 30, right? Like you need to, we want to prepare now for how far can we get by the time we're 50, 60, knowing that as we age, it declines, right? But if we can stave that off as much as possible.
So what is the recovery room?
Yeah.
Yeah, so the recovery studio, we have it in both of our Hamden and our Sparks office. So essentially it's recovery equipment that you can come in and use on your own once you've been kind of trained on it by one of us. So we include massage guns, we have the Normatec compression system, so you can do like compression boots for your legs to help kind of just flush out that lactic acid so you're not so sore after a workout. We also include blood flow restriction training in that. So it's just a bunch of tools that you can use on your own so that you don't have to go out and buy these expensive massage guns, these expensive foam rollers and compression systems. You can just come in here, sit back, relax. There's a TV. You can grab a cup of coffee, bring your laptop with you, and just hang out and do the recovery stuff that's good for you that oftentimes we miss out on.
Yeah.
And if you have a question or
Absolutely.
forget,
I was going to
here.
say, yeah,
Yeah.
one of the lesser advertised benefits of it is you're with your PT, right? It's not a session, you're not booking with us, but you're going to talk to us.
Yeah, we're here.
So tell us a little bit more about your personal story. You mentioned they're both certified physical therapists. Obviously you own a business together and you're together. So how did that all happen?
Yeah.
I'll let you take going.
All right, going back some years.
Yeah.
I guess we'll start with PT school. So we met at University of Maryland, Eastern Shore. Shannon's from Maine, I'm from Baltimore. So she came down. We started dating in PT school. After PT school, Shannon had to decide, do I go back home? Do I stick it out with this weird Baltimore boy? what's the plan? So we decided, let's stay here. There's more opportunities. And we both started working for essentially corporate America, like corporate physical therapy clinics. Throughout the first 5 or so years of our careers, we started taking a lot of the same classes. We had a lot of the same interests, so like kettlebells for clinicians, dry needling courses, blood flow restriction.
You have someone in your home to practice these things on,
Yeah,
so it's nice.
Someone who can't say no.
Exactly.
That's right.
I have an in-home PT at all times.
Yeah.
Which was really cool. And then during the pandemic, the place I worked for at that point, which was a private-owned practice inside of a CrossFit gym, the clinic owner moved and shut down the practice because the lease was expiring. He was gone. The pandemic was there. PPP loans weren't a thing yet. So I was like, okay, I get it. Right. So he moved. He shut down. My options. Yeah.
Yeah. Right.
My options. Shannon was there part-time.
Yeah.
But she was working another full-time job. And I was like, well, what do we do now? And the only people hiring were hospitals for the long COVID. It wasn't even long COVID at that time. It was just for COVID management. Go in a hospital in a hazmat suit. I was like, that's not what we want to do. We've always talked about owning a practice, and we're like, let's just kind of reinvent the standard of PT. And we started as just PT and then just kept adding and adding from there.
And are still adding.
And are still adding, yeah.
So you're located by the Union Collective, but in that strip part that is to the right as you're coming down the hill.
Yep.
So why locate here in Hamden?
Oh, I love Hamden. So my first job was actually in Hamden up at the Rotunda. So kind of fell in love with the neighborhood. Really diverse group of people, just kind of being wedged between like Roland Park and then like the more blue collar Hamden as well. It just has an energy and a vibe that we've always been really attracted to. And then one day driving down 83, Corey saw like a for lease sign right next to the brewery. So like, oh, might as well at least check it out.
Yeah, got a call. Yeah.
Full circle.
Yeah.
Exactly. So it just kind of it all kind of worked out, and the pieces just kept falling in the right order. We're just like, I think it's a sign that we need to get this place here.
Yeah.
So.
Every single step along the way. So like our landlord's just been amazing to deal with from the get-go, and it's just been a very welcoming area.
Great.
So
So if people want to find out more, what should they do?
Sure. They can absolutely go to our website, www.outlast.health.com. We have all of our information on there as far as class times, physical therapy appointments, our phone numbers on there if you want to just give us a call and talk to us and decide if this is something you would even want. We do something called discovery visits, where it's just a phone call with a therapist where you can just kind of talk through what you're dealing with and we can kind of figure out what path you might be best for.
yeah, and we put a lot of our stuff on Instagram.
Yes.
So our handle is Outlast Health. So easy to find us, and we're on there a lot too.
All right. Well, thank you very much. I really appreciate
Awesome.
this.
Thank you.
So more from Boots in Baltimore soon.
Thank you.